back to our channel. My name is Tony Green, the founder and CEO of the Faces of the Village. And today we're joined by a very special guest. He is our Health and Wellness Ambassador for Medicine, and this is Dr. Eric Roberson. Welcome.
Thank you.
So today we want to ask 3 questions, and we want to dive just a little deep into those questions and get the opinion of our medical expert. Dr. Roberson? So our first question today is, do you think that following the PCPs' advice will make a tremendous difference in the life of our client?
Absolutely. Following kind of health maintenance and disease prevention, as recommended by the doc, does a lot to prevent chronic disease in later years. Several of the things that I see that are not taken seriously by patients and honestly by some practitioners is the control and or surveillance of hypertension, high blood pressure, high blood sugar, diabetes, and high cholesterol. Those are things that, if treated early on, prevents the chronic illnesses, particularly end-stage renal disease, congestive heart failure, that we see how that affects the quality of life of our elderly ones. So following those recommendations are paramount to preventing those chronic illnesses.
And do you think in that same line of questioning that there is a difference among the racial divide, so to speak? Like, more common in the African American community versus, among the other races?
Yeah, that's something that we struggle with, but yeah, it's very clear that and there's several reasons. From a genetic perspective, we as Afro Americans are predisposed, and there's a lot of genetic things that we could talk about why we're more likely to develop hypertension. But to answer your question more directly, we're not taken care of, or the disease processes aren't taken seriously sometimes by our own Afro-American physicians as well. So the divide being, Caucasian patients with a similar illness and similar disease process get better care, but that better care sometimes is, because of financial, they have better financial resources, and generally society as a whole tends to look at an ill non-minority a little differently and have a different set of sympathies for them than they do for us. So there are a lot of things. I could talk for days about what I view as some of the discrepancies in the healthcare delivery system when it comes to providing care for minorities.
And so what would you say would be the 2 most common preventable diseases that you've seen in your line of work?
I won't say preventable, because there are some things that unfortunately just can't be prevented, and some of that is, again, boils back down to genetics and other socioeconomic things that make it difficult to say prevent. But there are 2 things that I think are very treatable that are not treated or, again, taken seriously, and those being, 1, hypertension. That's something that, if that alone were controlled, we would be able to stamp out a lot of chronic heart disease, a lot of congestive heart failure, and the thing that probably even more commonly is end-stage renal disease. So hypertension, again, is one of those things, again, not necessarily preventable in a lot of patients, but definitely treatable. The second thing being diabetes. Again, something that's not necessarily preventable, because sometimes when people develop diabetes early on in life, type 1 diabetes, that's been more, genetically linked. But treating it and keeping those blood sugars under control have a lot to do with, again, the chronic disease processes, kidney disease. One thing that people don't realize, in the United States, one of the most common causes of blindness is directly related to uncontrolled high blood pressure and uncontrolled diabetes.
Wow.
So those 2 things are the 2 disease processes that I'd say when someone has both of those and they're not being treated appropriately, it's almost a death sentence. Likewise, the most common cause of end-stage renal disease, patients that are on dialysis in the United States, uncontrolled high blood pressure, uncontrolled diabetes.
Wow, that is a lot of useful information. And are there any web-based resources that you would refer someone to that they wanted to learn more about? Say, for example, the kidney disease or diabetes, or, you know, there are so many different types of, or different levels of different illnesses like diabetes. You mentioned diabetes type 1. So.
Yeah, there's an abundance of information on the internet, some good, some bad. So I generally tend to shy away from making any real strong recommendations of a particular resource, but you know, in this day and age, you know, I guess I would be failing patients if I didn't, but you know, reputable sources like WebMD for the lay person that just wants to get a little information, you know, that's always a relatively safe go-to source. For someone who wants a little bit more information and some of the data and statistics that come along with some of these disease processes, the Centers for Disease Control, so the CDC.gov, has a lot of useful information. And for someone who's really wanting to see, you know, how is this impacting me or my age or my gender, it's to that level.
Right.
So it takes a little research to navigate that website or that portal, but you can get very detailed information from the Centers for Disease Control website.
And this is really just for my own personal curiosity, but the conditions that you mentioned, how would you say that they play into the onset of, say, dementia or any type of cognitive functioning?
Right. Yeah, difficult to make some strong links, but I can tell you, and again, just using high blood pressure as an example, I mean, we know that uncontrolled high blood pressure affects the vessels. You know, your vessels tend to get harder, less pliable. You know, over years, I mean, that affects the amount of oxygen that is getting to organs. So something as simple as that, you can make, you know, a reach to say that, you know, blood pressure were controlled a little bit better, maybe some of the dementia, and there are different forms, but, you know, one thing, ischemic brain disease, you know, something that, you know, I think most people could say there's a link, because if you're not getting proper blood flow to the brain, then there are a lot of disease processes that may be related to that. So again, this is Dr. Roberson's unresearched answer to that, but I think that there probably is a correlation, and if we looked hard enough, I'm sure I could find some data to support that.
Right. I totally agree that there are so many different conditions that are, you know, it's almost like a domino effect, which is what I experienced in my own health, that you know, I had this particular diagnosis, and because of that, I had to take this medicine. Well, because of that medicine, I now have this side effect, which has to be treated with another medicine, and it just got to a point where I was up to 15 medications a day, so I had to start making some really serious decisions. So, you know, I would venture to say that it's even more important for someone in our senior community to be especially careful about taking care of themselves, or having taken care of themselves earlier on, so that they don't experience those problems later.
Exactly.
So what would be 3 tips that you would give our clients or the caregivers or their loved ones?
3 tips with respect to caregivers that are trying to help or oversee a loved one. This would be being the champion. You know, for instance, so if someone has that, you know, dementia or chronic disease process, you know, the younger adults, i.e. us, other kids and family members, should be the ones to step up and be the voice for that patient that can't speak as clearly or voice their concerns as vocally as we can. So that would be probably the thing that I think is most important. Another thing that I've seen multiple times in the 20 years or so I've been doing this is when elderly family members get to the point to where they need decisions made, no one, if they haven't discussed those with family members, you know, there's a lot of discord. I've seen families literally broken up over, you know, what they thought mom wanted. You know, one kid said that they wanted one thing done, the other kid wanted something else done, and then there's a sister and a brother that chime in, and they're all fighting.
Right.
So I think it's very important to have a simple will goes a long way, but most importantly, since we're talking about health, is a directive to physicians, because that gives the physicians something to go by, some guidelines of what the patient wanted. And ideally, you'd want that to take place before their cognitive dysfunctions and problems that question, would bring into question whether they really knew what they were doing or talking about when they made those decisions. So.
Right. And so we are just going to ask, did you have anything else that you want to offer to our client base or their family members or caregivers today? Final word?
No, final words would be to go back to your first question. It's just following up with your primary care doctors and following those healthcare maintenance kind of recommendations and treatment recommendations. Because as long as you're taking care of those, what are initially are simple things, diabetes, hypertension, before they become something serious, you can prevent a lot of the chronic disease processes, and ultimately will help our elderly patients have a better quality of life in their later years.
And that's ultimately our goal. And so we want to thank you for joining us today, and we are asking that you hit that red subscribe button and follow us on Twitter and our Facebook channel, like us, and we look forward to bringing you additional content. We want to thank Dr. Eric Roberson for joining us today. He has been a truly, truly helpful individual in this matter, and once again, thank you for joining us, and have a good day.